All right, all you pharmacy peeps, we have a great episode today. We are going to be talking about monkeypox and your pharmacy and what you can be doing, or even what you should be doing if this is something that you want to help tackle in your community. So I have the wonderful Miss Tara Newton from TD Pharmacy Services, point of care testing queen, with us today to kind of give us an update, because frankly, I have not been researching this or really keeping up with it. I've been busy with this little thing called the Pharmacy Profit Summit. So I feel like I've had my head buried in the sand. And so when I was having a conversation with Tara, she's like, oh no, I've talked to this person and this infectious disease. And I was like, I'm just going to have you on so you can just share your goodness with everybody. So Tara, thank you so much for taking time out of your day. By the way, I really love your shirt. I love how we're twinning, totally by accident. But anyways, go ahead and introduce yourself to people who may not know you, and let them know like what it is you do and what's your specialty and why you even know about this.
Yeah, sure. So my name is Dr. Tara Newton, and I am a pharmacy owner out of Oklahoma City, recently relocated to Lexington, Kentucky. And infectious disease is kind of my sweet spot. So I did a lot with COVID, rolling out the vaccine, rolling out RegenCov, monoclonal antibodies, kind of you name it, I did it EvuShield. So when I started hearing about monkeypox popping up on my email, CDC alerts, all these things, I was like, okay, this is the next thing. No one's ready for it. We don't want to talk about it, but it's here, and we need to talk about it. So today I looked at the case numbers. There's over 10,000 reported cases in the United States.
Whoa, I had no idea it'd gotten that high.
Yeah. So as of recording on the 11th of August, the big states are California, Texas, Florida, and New York. So all those states have over 500 cases. So it's something that as pharmacy owners, we really need to be aware of, because patients are going to start coming and asking like, hey, can I get the vaccine? If I had the vaccine, 40, 50 years ago, is it still effective? So I just want to, kind of pop in and educate everyone on all these things.
And I really appreciate it because so monkeypox, you're absolutely right. So many of us are like, I'm not even over COVID yet. Like I'm still in the midst of COVID. We actually had a lot of people that couldn't show up to the Profit Summit because they tested positive for COVID. So many people are still dealing with COVID, and now you're layering on top 10,000 cases. That is crazy. I had no idea it was that high. And the last bit that I heard, which I really hate this generalization, but they're like, oh, the majority of cases are in, homosexual men. And the way that they say that, it sounds like they're the only ones at risk. And that is totally not the case. So kind of give us the down low on monkeypox in general. Like, what are the symptoms? How is it transmitted? Just give us the down low on monkeypox.
Yeah, absolutely. So monkeypox is really similar to smallpox. It's an orthopox virus. So the great thing is that we have a lot of data, a lot of information about smallpox that we can use to help combat monkeypox, specifically in Africa. So in Africa, there's a high number of monkeypox cases, especially in underserved communities. So we can take that information from there and, use it to help prevent hopefully the next epidemic. And you're right, Lisa, it is not, in the homosexual population. It is in all populations. Women who are pregnant are at risk. Children are at risk. Everyone can be at risk from it because it's as simple as just touching someone who has an open lesion and getting it, transferred. It's as simple as maybe even like the linens and clothes and things, and potentially even, and this is the scary thing, it can potentially even be airborne, which is not something anyone wants to hear about, but that's the reality. So all this, hugging and talking to each other up close, I mean, there is that risk that we can spread it that way. If you do get monkeypox, not the great thing, I don't want to say that, but the better thing than COVID is that it can be self-limiting. So you might get, a fever, definitely going to get a rash, definitely going to have, bumps that are going to be oozing. You can find that your lymph nodes are swollen, things like that. And it can last for, 3 to 4 weeks. So
Whew.
if you do get it, you do need to isolate at home for 3 to 4 weeks. Follow the same protocols we kind of did with COVID, with cleaning, isolating from your family, and waiting till you are free of symptoms to go out into the community. So that's kind of the lowdown on monkeypox. And then, of course, we definitely want to talk about how we're going to treat it, how we're going to test for it. And then there is a vaccine, because there's been smallpox vaccines for a long, long time. So that is the good thing, that there's already things in place that we can use to hopefully get this, under wraps quickly. So as far as testing goes, in the United States, the CDC has been the main ones that have been testing. And then there's also been a few testing centers, mainly at large hospitals, people who have high complexity CLIA tests. I've talked to some of my contacts at larger companies in China, and they already have a test for monkeypox. So I think it's just a matter of time before pharmacy owners are going to find that they can do those tests with PCR. So PCR is the gold standard. It's the only way to test for monkeypox. And you do have to test an oozing lesion to prevent from getting a false, negative or positive. So that's good news that, we learned a lot from COVID, especially the testing world. And a lot of people in China were able to roll this out within 2 weeks, which is phenomenal. Like they're ready to go. We just need to catch up.
The thought that you have to test an oozing lesion, kind of at that point, I'm like, do we need the test? Like if I have oozing lesions and I have all these other symptoms, is it worth it going out and getting tested, or should we just be focused on the treatment? Because it's kind of like, I have all the symptoms, if it looks like a duck and acts like a duck and walks like a duck, like, is it a duck? So how important do you think testing will be as opposed to just getting out treatment and or prevention measures?
I think initially, because our supply of treatment is so limited, that it's super important, because it can look like herpes. I mean, there's other things that are lesionous that it can look like, and we don't want to waste any of our precious resources treating someone who does have herpes, and that's not going to be effective for them. So I do feel like as long as our supplies are limited, that is an important piece right now. Once we're able to manufacture more treatments, then it might be something we don't run out and test and then treat, but there is that potential. So the CDC is the one who makes all the guidance on this, and that is the standard protocol at this time.
So when you're talking about treatment, what treatments are available for monkeypox? I know when COVID came out, there obviously wasn't treatments, but it was, hey, let's take our vitamin D, our vitamin C, our zinc, like let's help our immune system fight this. Is that kind of the same story for monkeypox, or what is available?
Yeah, so right now there actually isn't anything that is approved for monkeypox, but there are many drugs that are approved for smallpox that we know we can use in monkeypox because it's the same orthopox virus. So there is one that's very promising called TPOX, that I see that being something that's rolled out to pharmacies. It is oral form. The safety profile on it is very promising. And it's something right now that, there isn't a whole lot, and it's all controlled by the government, but I see it being, very similar to the other, things that we use for COVID. So I suggest that all pharmacy owners, start having these conversations with their local emergency medical centers. Whoever you're getting your, whoever you got your vaccines from, whoever you're getting your Paxlovid from, talk to them about how you can get on the list to start getting the treatments available to you once they do roll out on a wider scale. So right now, yes, TPOX is the main oral medication, but the government has it pretty locked down.
Yeah. I think you said an important thing there of like, raise your hand now, like, hey, I remember back when I owned my pharmacy in California, way back when, if you remember the big earthquake that happened in Japan that damaged their nuclear energy supplies, and they thought this toxic cloud was like coming towards California. Like it was a big thing. And if you lived in California, you were fearful that this toxic cloud was going to come get you. And just me reaching out to our local county, all the local authorities there saying, hey, I'm here to help. How can I help? I was included in on all of their planning committees, public forums, all those kinds of things. So I think it's really important for local pharmacies to just raise their hand, even if there's not a clear path forward for what that looks like now. The fact that you've raised your hand and you can actually be involved early in the process, I think is going to be better off. And so let's kind of switch over to vaccine now. So you mentioned the vaccine. Is the vaccine the smallpox vaccine, or is it just similar to smallpox and it actually is for monkeypox?
Yeah, so the vaccine is actually to prevent smallpox and monkeypox. So it's a Jynneos vaccine. It's manufactured by Bavarian Nordic. So it is a vaccine that is a little bit better than you think about everyone who got vaccinated in like the 40s and 50s, and they have that little scar, that inoculation scar. So that's the ACAM 2000. So that one is still available as well, but this new one seems much more promising than the ACAM 2000, which is actually like an active vaccine that is like growing in your skin. Not to say that we won't be doing that, because everything is in flux and we never know what we're going to be doing day to day. But the Jynneos vaccine, which is spelled Jynneos, seems to be the most promising. So it's very similar in the COVID to the COVID vaccine, the fact that you do have to take 2 doses and you have to wait 4 weeks in between the doses. And then 2 weeks after that is when you're considered vaccinated. So, there is a little bit of time. You're looking at 6 weeks from start to finish until you're considered completely vaccinated. So this is a really great opportunity, for pharmacy owners to go and get the vaccines and get their allocation, because it is indicated for PrEP, so pre-exposure prophylaxis. So this would involve the patient taking, one vaccine and then waiting 4 weeks, taking another vaccine. And then 2 weeks after that, they would be considered inoculated against monkeypox. And then the flip side to that is that there is a potential that it's very effective if you take the vaccine early after an exposure. So within 4 days of being exposed, if you can get the vaccine on board, it could lessen your symptoms of monkeypox. So it's very important, now for pharmacy owners to be going out and getting the vaccine in their pharmacy and actually taking it themselves to prevent themselves from potentially getting monkeypox. So that way they can serve their communities.
Yeah, that opens up a really good point of, paramedics and, doctors and hospitalists and pharmacies in the community of, getting inoculated. Because I know I'm of that age that here in the US, we didn't get vaccinated against smallpox at all at the point that I was born, because it is, was considered eradicated. And so there's a whole plethora of healthcare workers that have probably never been exposed. Only the people that are, a decade or so older than me probably have had that initial series at all, which I don't even know at this point, if it's effective anymore. And so since it's been so long, and so that is something to consider, I think, and to bring up, as we talked about earlier, of like raising your hand, of talking to your county of like, who are those priority people? Because it does take 6 weeks to be considered protected. Who do we need to start inoculating now so that we have those protected healthcare workers in order to take care of the people? Now, like you said, the symptoms people aren't generally getting hospitalized by monkeypox like with COVID, where people were getting hospitalized and there was tragic consequences. This is really more of like, you're very uncomfortable for several weeks, you have symptoms, and you need to isolate, but then it's self-limiting. You tend to get over it. And so kind of besides the rash and possibly a fever, is it itchy? What are those kinds of like initial symptoms of the rash? Because when you say pox, my experience goes back to chicken pox, back when I had chicken pox when I was like 8 years old, and there was just that inconsolable itch that came with it, which then we were worried about secondary infections. But, what other kinds of symptoms would patients be going through? Because what I'm thinking of as a community pharmacy and how I can help pharmacy owners prepare is let's have that kit. Let's have those OTCs or RXs kind of ready to go that are going to help with those symptoms, to at least have some palliatory and some, let's make them feel good while they're having to go through this.
Yeah, absolutely. Because, if you're not immunocompromised, and you aren't like a high risk patient, you're not going to be getting the oral medication at this point. So it is all, palliative care. And you're talking 3 to 4 weeks being at home in isolation. So yes, so some calamine lotion definitely would, be helpful because it does itch. It is a lot, like it's, not in the same family is chickenpox,
Right.
but it is a lot like chickenpox. So you might get, areas of redness and itching, and, you scratch it at night and you make it worse, and then you spread and you get secondary infections. So yeah, so that is a big concern. Fever. So you think about adding Tylenol to those kits. You talk about like, maybe even, like your lymph nodes being swollen, things like that. So that might, cause you to not feel as well. And you have a little bit of a cough. So maybe some, cough drops, something just to soothe the throat. And then, a lot of rest. So I see this, just like anything, you want to keep your immune system working at a high level. So, how do you do that? Vitamin C, vitamin D, make sure you're taking your B complex, the same things we kind of talked about with COVID. We need to be talking about with monkeypox as well. And flu season's just around the corner. So, make sure your immune system is working at optimal level, get rest, get exercise, to really help, to hopefully prevent you from, being infected. But yes, as far as pharmacy owners, making a wonderful kit, someone could call up and say, hey, I have monkeypox. You say, hey, don't come into my store. We will bring you a bag of goodies to your car. Like, what are your symptoms and what do you think you need for 4 weeks? Because you don't need to be leaving the community again.
Right.
So those are some things that I would definitely stock up on. Calamine lotion would probably be the pretty big rate limiting, because it's not something we just have a bunch on our shelves.
No, absolutely. I think from a prescription standpoint, Crotan lotion, which is an amazing anti-itch, that really works at the nerve level to stop nerve transmission of the itch, I think would be a really great option as a prescription, as well as clemastine liquid, which is kind of a first generation antihistamine. So it's going to be very, very good against the itch. As well, and can help you sleep at night because it does cause drowsiness. So I think that maybe even layering in some of those prescriptions, maybe even starting to educate doctors now, because you can't be using lidocaine all over your body. You're going to worry about, getting overdoses and things like that. And people will do drastic things, as we saw with COVID. They will take matters into their own hands and maybe not make the best decisions. So I think even starting to educate local doctors, like, hey, we carry Crotan lotion. Hey, we carry some of these, clemastine or some of these other anti-itch remedies, so that if they start to get patients, because with 10,000 cases, I'm afraid that's going to be 20 and 30 and 40, like really quickly. It will come to your community. And that way you can start to be that source of information and solutions, instead of just, throwing your hands up and being like, go deal with it kind of thing. And so I think that's a really important aspect. So Tara, thank you so much for sharing your information. Lots of things about lots of things, and point of care testing. And like you said, infectious disease is kind of your jam. If somebody wants to reach out to you, figure out what you're doing, how you're doing it, and to maybe learn from you, where can they contact you, or how can they find out more information?
Yeah, absolutely. So they can email me at tara@td.care or go to td.care. So just www.td.care, and find my website. And my cell phone number is 580-302-1611, and anyone's more than welcome to call or text me anytime.
Awesome. Well, we will keep in touch, of course. And as things change, I will make sure to get that information from you. And, we'll maybe do shorter little updates as things happen, because we all know how fast that the world can change on this. And it can go from, oh, let's not worry about it, and you don't need to wear masks, to where, we're in lockdown for it can happen very quickly. So we will make sure to update all of our viewers as the information becomes available. Thank you so much, Tara. And I look forward to talking to you again and staying up on this myself.
Thank you, Lisa.
Thank you. Bye-bye.
Bye.